Welcome to Local Discovery Spotlight on Health. Today we go inside the beautiful Central Maine Medical Center in Lewiston. I'm Tori Ryden. CMMC not far from the rushing waters of the Androscoggin River, flanked by the magnificent Cora Temple and a stone's throw away from the esteemed Bates College. From the award-winning Central Maine Heart and Vascular Institute to the Orthopedic Institute of Central Maine, where brand new techniques are being performed, to awe-inspiring stories of weight loss at Central Maine Bariatric Surgery Center, CMMC boasts world-class doctors and caregivers. But don't just take my word for it. In the next half hour, you're going to hear amazing stories from patients who say they learned firsthand what CMMC can do for them. Some of them say the hospital has saved their lives. So stay with us for this edition of Spotlight on Health here from beautiful Central Maine Medical Center. You've heard it before, when you have a heart attack, every second counts. And for Nick Riggio, the decision to have the ambulance take him to CMMC in Lewiston truly meant the difference between life and death.
I was prepping for a doctor's visit that morning, and as I was in the shower, I felt this tightening in my chest, which felt odd, but not odd enough. So when I got out of the shower, it started getting tighter and tighter. And I called my wife downstairs. I said, "Marianne, there's something happening. You need to get up here." And I laid down on the bed, and she came up here, and she's a CNA, so she has some nursing experience, and she said, "We need to call 911. At this time, I just had this terrible chest pain, so that's as far as it was. He said, "We have two choices." He said, "We could either take you locally to the local hospital and be stabilized, and then we can take you either to Portland or Lewiston to the heart facilities there." And I said, "Well, what would you recommend? I've never had this happen to me before." And he said, "We would recommend CMMC because they have an excellent cardiac section there." And he wheeled me directly in. There was no waiting whatsoever, very little talk and everything else. He set up two television screens right above my head so that we could both see them. And he put this catheter in, and then he injected a dye. And you could see where the dye stopped moving, just a couple little spidery lines coming out where it was heavy at first and almost down to nothing. Through the catheter, he must have drawn out this clot, whatever it was that was stopping my blood flow. And as soon as he popped it out, it looked like the 4th of July to me. Everything just popped wide open and the blood was pumping everywhere that it should have been, and which I found amazing. And I could see it right on the screen as it was happening. And I was talking to the doctor too. It was just like we're talking right now. And then he told me he was going to insert a stent. He did the stent, and we were in and out in almost no time at all. I don't think we spent more than 25 minutes at the most in that room before I was in my bed at the hospital. I just felt so comfortable being there, and happy when I left because I felt great.
When a patient arrives to the hospital who's having a heart attack, and the diagnosis has been made in the field, for example, with an emergency medical crew that has the capacity to do an electrocardiogram on site before the patient arrives at the hospital. The cardiac team has hopefully already been notified about a patient who's about to arrive. The physician has been notified, and plans are being made to take that patient directly to the cardiac cath lab, this place, in order to stop the heart attack.
Mm-hmm. And literally you pull the clot out?
Well, sometimes we pull the clot out, but basically we open up a blocked artery, and that generally involves stretching open the artery where the blockage is. Some arteries can be closed with a very tiny amount of clot, and you really can't pull out a significant amount of clot. Other arteries, depending upon the size and the anatomy of the artery, might have a considerable amount of clot there, and in those cases we use various devices to basically suction out part of the clot, but almost always have to fix the artery where the clot occurred by putting in a device called a stent.
You're doing amazing things here. I mean, you're saving lives every day.
Well, it's very satisfying work to do that, and it is done, of course, all over the country.
Intervention being really the key word here for you.
Yes.
Okay, thanks, Dr. Phillips.
When your heart speaks, listen. If you experience the symptoms of a heart attack, don't wait to take action. Call 911 and please don't try to drive to the hospital. Our EMS providers are trained to diagnose heart attacks on the scene and notify the hospital prior to your arrival. CMMC has the first accredited chest pain center in Maine, and our patients have access to advanced cardiac care provided by the caring, compassionate staff of the Central Maine Heart and Vascular Institute, Maine's newest and most innovative cardiac center. The Arbor House offers caring support for the families of patients, and after surgery, cardiac rehab helps patients recover and return to a happy, healthy life. The Central Maine Heart and Vascular Institute in Lewiston, Maine. Specialized care for the heart, from the heart, close to home.
CMMC gives families in the third floor waiting area a nice respite, a garden filled with trees, and a real nice homey atmosphere as well. And on the first floor near the cafe, you can check out the CMMC Women's Hospital Association's rotating art gallery featuring the works of local Maine artists. From heart attacks to car accidents to other medical emergencies, this is where some 50,000 people wind up every year, and it's a brand new emergency department. Joining me right now is the Director and Supervisor of Nursing here in the Emergency Department, Peggy McCrae, and it really is something, this whole new emergency department. I guess what's the reason for it? It's beautiful.
Yeah, you mentioned it, 50,000 visits a year. We were in an emergency department before that only could accommodate 25,000 visits, so we needed to expand to have the rooms available for the patients that we need to see. It really was to ensure that we can provide services to not only the Lewiston Auburn area but all of Central Maine. And part of the issue with our emergency department was not only the bed size that we had before, but what's the setup. We now have individual rooms for every patient, so from privacy, confidentiality, infection control issues, comfort for patients and families, they can go into individual rooms and be comfortable during their visit. No one wants to stay a long time, but at least if you have to stay during the process of being cared for and us trying to diagnose, we want to make sure it can be as comfortable as possible for you.
It's beautiful, and it's also really quick. A lot of people praise CMMC for getting people in very, very quickly.
Yeah, we've really tried to change our processes, you know, not only with the new emergency department with new rooms, but also look at our processes of how we can get patients back in front of the physician, because they're not necessarily here to see me, they're here to see the physician. So we've done a lot of work with our teams to see how quickly, you know, try to get them in front of the physician as soon as possible.
And speaking of physician, we're going to go talk to Dr. Oliver right now. So thank you so much.
Good.
It's beautiful here.
Thank you.
And joining me now here in the Trauma Center at CMMC is Dr. Lanny Oliver. Really nice to meet you, Dr. Oliver. This is really amazing. Everything brand new. Tell me about a trauma center. What is it used for?
Well, the big piece is we're part of the larger puzzle here in the state of Maine. There are 3 trauma centers. We're one of 3. Portland and Bangor have the other 2. And it's a big team approach to the management of trauma patients. We've got a team of trauma surgeons and emergency medicine physicians that form the core of that team, and you're in the trauma center.
And who is a trauma patient?
Trauma patient, anybody with a serious injury, potentially life-threatening injury, those are the types of patients that would be brought here.
Okay. So Life Flight factors into that as well. It's a helicopter that brings people here to the trauma center, right?
Yes. Life Flight's a key portion of what we do. Life Flight shortens the distances for patients traveling throughout the state of Maine. So our patients come to us from central Maine, but also western Maine and New Hampshire. So travel times are particularly a problem in the winter, so air transportation shortens those distances for us.
It takes a special person to be one of those pilots, doesn't it?
It takes a special person to be a part of the any part of that crew, which is the pilots or the nurses or the medics.
I mean, they are the first group that gets a hold of the patient.
They're frequently the first responders. Life Flight will land places that ambulances don't have access to, so they'll pick up patients right at the scene. And other times they'll pick up patients that are being transported by ambulance. What they'll do is they'll meet them en route and shorten the ambulance transport times.
And what they get started, then they hand off to you.
That's exactly right.
So how critical is Life Flight? Well, every year between two Life Flight bases, they take 1,500 patients on Life Flight missions. And joining me right now is a Life Flight nurse, Sam Schaub. Nice to see you.
Likewise.
You are a very busy guy, 1,500 flights.
Yep, we fly all over the state of Maine, as well as we transport throughout New England.
Tell me some of the people who you're transporting. What are they afflicted with?
Well, we fly a large number of cardiac patients. We also fly a fair amount of traumas, neuro patients, as well as specialty services for pediatrics or other such things.
Stressful job?
It's pretty intense. You know, we have a lot of training before we get started on here, and the whole crew is very dedicated.
And I know on board you have everything that you need.
We basically have all the same equipment that they have in the intensive care unit as well as in the emergency room, so we can take care of patients, ages from 2 days on up all the way up to 100 with any sort of medical or trauma problems.
I know you're highly trained. You're not a doctor, but you really actually have to kind of act as a doctor on board this.
Yeah, we operate under the guidance of a clinical practice committee, which is a group of about 15 doctors that oversee what we do. They provide the training and the resources for us, and then we're able to make all those decisions and do a lot of the same procedures that the doctors are able to do in the emergency room or in the intensive care unit.
When someone has a stroke, what do you do?
The biggest thing is to get them to a certified stroke center in a very timely manner. This helicopter goes about 170 miles an hour, and so we're able to go from point A to point B in a very timely fashion. In addition, we have all the medications and machines in order to keep them stabilized throughout the transport.
Sam Schaub, you've got a very important job. Nice to meet you.
Thank you. Likewise.
Thank you very much. And I am joined by one of the very first people who was on board the Life Flight, Carl Grove, who's the Director of Pharmacy here at Parkview Adventist Medical Center. And Carl, you were in this very office. You had a stroke a year and a half ago?
Yes, I did.
They took you on Life Flight. Tell me about that.
Well, one of the tests that I needed here wasn't available soon enough, so that decision was made to take me on the helicopter to Lewiston. What I recall of it was that it was very smooth. You know, they wheeled me out there. Everyone was very professional, and it was very quick once they got into the air. I don't know how many minutes it is, but it's very quick, 7 or 8 minutes. So the whole thing might have taken a half an hour to get me out there, get me on the chopper, and then get me out again. At the point that I was being taken out, I don't remember a whole lot, unfortunately because of the stroke, but my wife was with me, and you know, she said it went well, obviously. I got there and got there quickly, so it was good.
I mean, it really saved your life.
Yeah, it made a huge difference, it really did, yeah.
You feeling good now?
Yeah, I do. I feel well, so I'm lucky.
And new to CMMC, stroke patients now brought into the hospital have access to some of the world's top-level stroke experts thanks to a new deal with Mass General Hospital down in Boston. Joining me now to explain all of this is neurologist Dan Bobker. How does it work?
Well, let's take a moment to talk about what the problem is. When a patient has a stroke, a blood clot forms in the brain, depriving the brain of oxygen. In the past, we've had no way of treating that. But in the last 10 years, there's been a treatment called TPA, or tissue plasminogen activator, that can dissolve those clots. The catch is the TPA has to be given within 3 hours of the onset of symptoms. So that works well at a big university hospital where there are doctors in-house all the time. But at a smaller community hospital, we don't have doctors on site around the clock. That's where the teleneurology comes in. Teleneurology lets us have access to a Mass General neurologist within 10 minutes of the onset. And they can walk through the process with us, and we can give the TPA drug within that time frame we need to.
Which is where this television screen comes in.
Correct.
Teleneurology meaning television, so they can actually see patients here?
Right. A patient will come into the hospital here. We call Mass General up, and within 10 minutes we have a stroke neurologist on the line. They can see the patient can see them, and we can go through the process of seeing if they're appropriate for this clot dissolving drug.
That's really amazing.
Yeah, it's a great new development in the field.
It's good for you guys, it's really great for the patients because it gets them exactly what they need immediately.
Right, there's no delay trying to get all the doctors assembled. We have the doctor online within 10 minutes.
And also it means that probably patients will be healed quicker?
They can get the drug they need in the time frame they need it within that 3-hour time window.
Wow.
Yeah.
Teleneurology, saving lives here at CMMC.
It's a great development.
The new Orthopedic Institute of Central Maine at Central Maine Medical Center.
There's an integrated physical therapy department on the floor, just steps away from their room. The operating room is on the same floor around a corner. Everything is focused on quick and risk-free recovery.
Everything you need right here in our state-of-the-art facility, so you don't have to go anywhere else.
I'm recommending this place, and actually the doctor I had to everybody I talked to.
Learn more online, the Orthopedic Institute of Central Maine with Core Connect Care.
Did you know that an aging population means a rise in orthopedic procedures? An estimated 500,000 total joint knee replacements are performed annually here in the U.S., including right here at the Orthopedic Institute of Central Maine. And joining us now is Dr. Jeff Bush. Nice to meet you, Dr. Bush.
Thanks for having me.
You're just back from doing a total hip replacement, which sounds very involved, and you've got a show and tell.
This is a fresh x-ray here. This is a 50-some-year-old guy who actually was on a bike, hit by a car a couple years ago, and sustained some fractures around his hip. And initially it didn't look that bad, but over the past couple years he's gone and developed very advanced arthritis, mostly secondary to the trauma. And so we brought him to the OR today and replaced his hip.
And after this, will he be just back on the bike?
He should do well. I'd expect him to be back on a bike and up to full activities, within the next couple weeks. He'll be here for a day or two. He'll go home tomorrow or the next day. He'll do physical therapy today. He should be on the floor within the hour, and within an hour or two of that, we should have him up and walking. And after another day or two, he'll go home. And
what's so impressive is that everything is all here on the floor. I mean, the patient is completely seen right here.
The care is excellent. I think that's what sort of sets this place apart. Once we schedule them for a procedure, they come here and they go to a total joint class for a hip or knee replacement. And from the moment they get here, they have dedicated orthopedic nurses who are trained in taking care of joint replacement patients. And the therapist will see him the day of surgery, get him up and walking. And just the combined effort of not only those people, but the administrators and the other staff who've been involved in really providing a focus on the patients just makes it a special place. And this guy, he'll have great care, and he'll be walking right away, and he should do really well.
That is fantastic. And you also see people who need help with their spines as well.
We do. Dr. Regan's our spine surgeon here, and he does a lot of spinal fusions and discectomies and that sort of thing. And I see a lot of hips and knees. I do mostly hip and knee replacement. And we've been very happy with the results. I think since we opened the unit, the length of stay for the patients has dropped significantly. The majority of our patients are leaving before 3 days on the unit, which for joint replacement is a pretty good number. And they're doing well. We have low complication rates and great staff, and I think part of it is because of just the overall staff and the amazing amount of people that is just focused on the care of one individual patient, and I think it shows with every patient.
Well, it's close to noon, and Dr. Michael Regan has already completed 3 surgeries this morning. Busy day already, Dr. Regan.
A typical day here at Central Maine Medical Center.
And all of those surgeries went well.
Yes, yep, it did. All spinal surgeries.
And tell me about them.
Well, 3 different people with 3 different problems. 2 of the people had pain in their leg. Contrary to popular belief, most spinal surgery is done for patients with pain running from their buttock into the leg. And so 2 of these patients had pain from the buttock running into the leg, and they had pressure on the nerves in the back, both due to disc herniations, slip disc as many people know it. And the surgery is a very small incision, and what's called a microdiscectomy, and the small piece of disc was taken out to relieve the patient of their leg pain. Both patients did fine, and both are going to go home. Both actually are probably in their car already on the way home.
You've got to be kidding me. It's that quick?
I wouldn't kid you. Yeah.
Wow.
So both of those are home, and then another one with a fracture. We fixed that through a poke hole in the skin. We can put some cement into the broken bone, and that person will also go home today.
Oh my word. Things have changed, haven't they, in the
They
world
have.
of
My God.
orthopedics?
Sure. I mean, years ago, that was, many years ago, that was a 6 or 7 day admission. But even, 10 years ago, it was a few nights in the hospital. But now it's just all day surgery.
Well, it's a beautiful place you have here. OICM is really gorgeous. You have a whole team approach, really.
it has. From the inception of the whole OICM, it's always been a team approach. Certainly there was days when the surgeon told everybody what to do, but those days are over. Now we have a top shelf group of nurses, physical therapists that work right here on site. Team approach, we all know we're doing. As a matter of fact, this morning I started my day actually by discussing with the nurses. We met at 7 o'clock this morning, and we had a little conference, and I actually gave a little tutorial on some spinal surgery issues with the nurses. So I sit with, there were probably about 10 nurses. We sat and we talked about a couple spinal surgery issues so they understand what I'm trying to accomplish, why I'm trying to accomplish it. And then so there's no question about what we're doing, and they understand what I do, I understand what they want, ask questions.
Really important.
Very much a team approach, and we do that just about every week.
Well, I can't leave you without introducing Bonita right here, your girlfriend.
I spent a lot of time with her putting her together, actually.
Really? So
Absolutely.
she helps a lot, huh?
Absolutely.
Yeah.
We put all these plates and screws here on the clavicle, the spine work, screws in the back of the cervical spine, the thoracolumbar spine, and down here at the lower spine. We put a halo on her in case she had a fractured neck. We also, a lot of spine insurance is done through the abdomen or through the chest. These plates and screws are put in the front here. Very common to do this kind of work also in the spine. Not to mention all the other bones.
Sure is good looking.
Yes.
Yes. All right. Well, thank you very much, Dr. Regan. Really great meeting you.
Thank you.
Did you know that shortly after taking office, President Barack Obama instituted what's known as Meaningful Use? It's an incentive program for hospitals and physicians' offices to convert paper medical records into electronic medical records by the year 2015. And joining us now is Nancy Grenier, and she's the Director of Care Integration for Central Maine Medical Group. And you are using this computerized system every day.
Every day. We have clerical staff, we have nurses that help run lists, review the list on patients overdue for screenings, and reach out to these patients, encouraging them to come to have those screenings done.
This is all part of an overall program called Saving Lives. I mean, it sounds like it's exactly what you're trying to do.
Correct.
And how's it working so far?
So far, we've already identified 228 patients with precancerous polyps on their colonoscopies, 7 colon cancers, 4 breast cancers, and 6 patients for urgent surgery for AAA screening, with a AAA screening.
So basically, through the computer programs, you're able to then send out to patients, urging them to get screenings when maybe otherwise they wouldn't come in for screenings, and you literally are saving lives.
We are.
Wow, great program. And has it been well received?
I think the providers enjoy it, like the program, because we're helping them manage their patients. I think patients have been fine with it. We do calls occasionally, and some of them are happy we're reaching out to them.
Thanks, Nancy.
I think it's great on a number of levels. I think it sends a message to patients that we care about them. And the encounter of the medical experience is beyond just the exam room. We're reaching out to them. It's population-based medicine where we're able to screen patients and reach patients in much greater volumes than we are just by the daily experience of seeing patients in the exam room. There's some wonderful vignettes of individual patients who literally their lives have been saved, particularly from the aneurysm screening. We also, as Nancy had mentioned, have picked up some early colon cancers that have saved patients' lives and more major operations in the future.
Cardiac care is best when it's close to home and family. That's why in offices throughout Central Maine, the Central Maine Heart and Vascular Institute is bringing advanced cardiac care to where our patients live.
Having the opportunity to have care close to where they live provides them with an opportunity to get the best medical care they can get close to home.
Specialized care for your heart, from the heart, close to home.
Did you know that CMMC has its own museum? From old photos from its opening days back in 1891. In addition to old photos from the hospital's opening days, there are original surgery kits. How'd you like someone cutting into you with one of these knives? They're from 1840. This iron lung from the 1940s was used primarily for polio patients, helping those who couldn't breathe on their own survive. Other relics include a nurse's cap from 1900 and a wheelchair reminiscent of the FDR days. At CMMC, 2 surgeons are taking on what has become a top killer in the U.S., obesity. Each year, it kills almost 500,000 people. Now, the medical director at Central Maine Bariatric Center, Jamie Loggins, is here right now, and that's really kind of a horrible statistic to hear that.
Yeah, Tori, it really is just a horrible disease that many people, I think, just don't realize how much of an epidemic it really is in our country. You know, we talk about up to 500,000 people who will succumb to complications of obesity and its related comorbidities. But if we put that into some perspective, if we were to take, say, colon cancer and breast cancer, put all of the people that may die from those 2 diseases together, it's about 90,000 people. So we're talking about a disease that claims the lives of more than 3 times as many people as 2 major forms of cancer put together. That's really the significance and the proportion of what we're talking about here.
Let's talk about the procedures that you offer here.
We offer pretty much the whole gamut of what are considered the standard weight loss surgery options, and not even just weight loss surgery, but metabolic diseases as well. So we offer gastric bypass operations, adjustable gastric band, vertical sleeve gastrectomy. These operations obviously are meant to help people live fit, healthier lifestyles. But the interesting thing that we're seeing is the direct effects it can have on some of the medical problems associated with obesity, things like diabetes and high blood pressure, obstructive sleep apnea. We've often thought that if we can make people more fit, we'll see improvements in these medical problems. But interestingly enough, we're seeing these dramatic changes, sometimes within days to just a few weeks of an operation, meaning that there's something happening primarily because of the operation, not just because of the weight loss.
We've got 2 patients who you use these surgeries on, and we're going to hear from them right now.
Yeah, my blood pressure was out of control. I was on a very strong hypertension medication. I had severe sleep apnea. It was just, things weren't good. I was headed for an early death, there's no question.
Before surgery, I was on 2 medications for my diabetes. I was on medication for high blood pressure and high cholesterol, and now I'm on 1 pill a day, and that's my multivitamin.
So those were great stories. And Lee, actually, she has no more diabetes? Is that true for a lot of people?
Absolutely. It's the most remarkable thing about some of these procedures that we do is not just the impact it has on their weight, but on the medical problems associated with obesity. Probably nothing greater than what we see with type 2 diabetes. Up to 90% of people who go through gastric bypass, we see resolution, if not improvement, of their type 2 diabetes, and it's usually within days to weeks. I oftentimes tell people if an operation does nothing for you but cure you of your type 2 diabetes, that alone would almost make this a worthwhile procedure. So it really is an opportunity to just positively affect people on so many different levels.
You and Dr. Steve Bang work together here. Does it just give you great joy, what you do?
Absolutely. To be able to be involved with the changes that we see people going through for the whole rest of their life. You know, when we see patients back in follow-up, that's our favorite day because we feel like we're part of those folks' lives after that. And it's not just Dr. Bang and I, but our whole team. I mean, we're all here dedicated to making and improving the lives of our patients, and that's what our commitment is, and that's what our focus on. And the whole team here, really, you can see that they have a passion for what they do.
Dr. Loggins.
Thank you.
Talking with you.
You too. Thank you, Tori.
Thanks for joining us here for Local Discovery Spotlight on Health here at beautiful Central Maine Medical Center. I'm Tori Ryden. If you like what you saw, check out CMMC's website, cmmc.org, or you can check out our website, localdiscovery.tv. Thanks for joining us.